TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. Tonight we have a February is American Heart Month episode to start the program, and the second half of the program you're going to want to tune in because we're having our first spine surgeon on the air in the last 2 years, so really excited about both because the heart is, nothing to mess around with nowadays with all the diseases and ailments that can unfortunately shorten your life if you're not careful. But without further ado, I'm going to get right into it. We have Dr. David Perloff here. He's a cardiologist, Tenet, Florida Cardiovascular Care, right around the corner in Fort Lauderdale, which is, I think, just a short drive from here this time of the day. Dr. Perloff, welcome to the program. How are you doing?
Doing great. Thanks so much for having me.
Thank you for coming aboard. And I wanted to have you for a while. February is American Heart Month, and it's really a time we should always be thinking about heart health, but this is a time where we can bring awareness, whether it's, I've seen a lot, last Friday we all wore red for, wear Red Day to bring the awareness to women's heart health. I know there's events with American Heart Association all over Palm Beach and Broward County for the rest of the month. So I'm really glad you were able to join us today. And let's get right into it. I know there's some timely news out about you, and I just want to share with the listeners, Dr. Perloff has just been elected president. Yes! You're my guy. I'm so happy. No, president of the Florida chapter of the American College of Cardiology, the ACC. That is a great organization. I can't believe when I was doing my research, 49,000 members. How did you become part of the ACC in the first place?
So, for those who are not familiar with the ACC, the American College of Cardiology is really the premier organization for cardiologists. They put on the largest medical meeting every year in the entire world. And it is, it's an organization that is, whose mission statement is to, transform cardiovascular care and improve heart health. And that's what we're all about. And it's got several arms associated with it, including research and education and advocacy for patients, for physicians, et cetera. And so, this is a great national organization. We, do lots of research that gets presented through the American College of Cardiology. And so this is our organization. I started out on the board of directors of our Florida chapter about 6 years ago, and was asked this last year to run for president of the Florida chapter, and I won. So it's a 3-year term. And it will start, actually, I'm currently president-elect, is what they call it, incoming president-elect. And my term will begin March of 2019 through March of 2022.
Congratulations. That's fantastic news.
Thank you.
I was going through doing my research yesterday, and I saw all the states, and there you were, president-elect for Florida. I mean, true story right there. So that was really neat to see all the states. What a great organization. And I was reading a little bit about, and you kind of mentioned it, it kind of brings the community in, the community aspect of getting the word out about cardiovascular health. I saw that was an important point that they were making on the site, so that's great. Now, what does being president of the chapter entail? I know you got a little bit into it there, but do you lead like a local meeting every month? How does that work?
So there's a lot of stuff that that the president does. So first of all, it's kind of a dual role. So as I said, it's the president of the Florida chapter, but it's also the governor for the state of Florida on our National Board of Governors. So the National Board of Governors is sort of the governor of each state or of each territory is sort of the grassroots link between the members and their needs and the what we hate to say the term national, but national ACC, who is comprised of the board of trustees and the board of governors and then the CEO and the president, et cetera, et cetera. So it's really I'm sort of the liaison for the state of Florida to the board of governors and to our leadership. The interesting thing about the state of Florida is that the state of Florida was actually the first state chapter of the ACC ever. And we are also the most active of all the state chapters. So we have huge volumes of a large percentage of our cardiology community are members of the ACC and members of our Florida ACC. Whereas with other states, it's not so much. Maybe 50% of them are members. For us, it's somewhere in the order of about 85 to 90% of our cardiologists in the state of Florida are involved with the ACC, are members. So what I do as the president is we have 2 meetings that we put on, and so I'm involved in putting on those meetings. I also travel throughout the state advocating for us as cardiologists. We do legislative conferences where we go and meet our legislative leaders both at the national level and at the state level to try to advocate for our patients and for our cardiologists and for appropriate cardiovascular care. So it's a lot of work, and my job is, if there are concerns in our cardiology community or our community in general regarding heart health, is to take those up to the leadership in Washington, our headquarters for the ACCs in Washington, and to take it up there and advocate for the members of our state.
Wow, what a great network! I mean, I'm sure you're a man who can get things done in a jiffy there. That is a great network, though. I don't mean to make a joke about that. I mean, it sounds like a very fascinating organization to have that many members in Florida and the state. Are these cardiologists and cardiac surgeon, cardiac electrophysiologist, pretty much anyone who deals with the heart? So
that's a great question. Originally it was meant for cardiologists, or it was an organization only of cardiologists, but historically we rapidly brought in cardiac surgeons. In fact, some of the governors are actually cardiac surgeons. We involve all specialties of cardiology, which include electrophysiology, invasive cardiology with interventional cardiology, pediatric cardiology. We have all subspecialties of cardiology, and then we have now started a CVT council, which is for our cardiovascular team members, and this started several years ago, and we've been expanding this. So that includes nurses, cardiovascular technicians, so people who work in the cath lab, echocardiography technicians, nurse practitioners, physician assistants, people who are all part of the team, because we recognize that as cardiologists, we do a lot of really great stuff, but we can't do that alone. And that's really part of the team approach to care. And when it comes down to our organization, we recognize the importance of everybody and their roles on the team. And so that's actually our fastest growing, largest growing, or most rapidly growing, let me say, section of our membership.
Wow, that's great to offer to everyone. And we had, the listeners will remember, Daniel Mock on the show. He's a clinical cardiac nurse practitioner. I may have got his title a little wrong, but he's a nurse practitioner in cardiology, and he was on the program. I know he does works with some of the cardiac surgeons in Palm Beach County. Do you have you worked with current Florida Board of Governor Dr. Fred Kuzumoto of Jacksonville?
Yeah. So Fred's been our president now for about 2.5 years, or maybe a little less, maybe almost 2 years. And he is a terrific guy. He works at Mayo Jacksonville. He's an outstanding electrophysiologist up there. Prior to that, he was very involved in being the chairman of the education committee for our Florida ACC, and would be the point person on putting together our annual meeting. Our annual meeting has gotten awards by the ACC, multiple times for, this last year we had over 200 people came to our meeting. It's an annual meeting that we do at one of the Disney resorts every year in August, right before the kids start school. So everybody brings up their families. It's a great time to get together, and we have outstanding national speakers, people who are, folks that write the books in cardiology come and speak for us, and it's just been a spectacular meeting. And so Fred's been very involved in that from the education standpoint, and that's the really great thing about becoming governor and president, is that I really have some amazing people in front of me, like Fred Kusamoto, like Alan Seals, who's our past president, and he was just last year was the chairman of the board of governors, and several other governors in the past who are really leaders and great role models for me to be able to help me in accomplishing what I want to for my presidency.
That's fantastic. And we're here with Dr. David Perloff. He's a cardiologist, Tenet, Florida Cardiovascular Care, 2307 Broward Boulevard, Suite 101, Fort Lauderdale. It's really not that far from Boca Raton here, about 30-minute drive and no traffic, and maybe up to 45 minutes with a little traffic. But great heart hospital there, Florida Medical Center. You're also on staff at Florida Medical Center as well. Excuse me. And medical director of cardiology at Florida Medical Center as well. So, wow, you're the medical director of the hospital. That's another. When do you have time? You were telling me about your personal life before this, too.
So I'm a pretty busy guy. I'm the medical director of cardiology at Florida Medical Center, and I do a lot of different things. But to me, it's very important to be involved not only in medicine, which is sort of like my number one primary passion, right? Is taking care of patients, and that's what I do mostly. But also making sure that I advocate for us as physicians. I advocate for patients. I go on medical missions. I'm the past president of our Broward County Medical Association, and then in trying to build and improve things at Florida Medical Center is another challenge. And it's a great medical center that has amazing opportunity. We've got great surgeons and electrophysiologists, and putting that all together into an award-winning team is really it's very satisfying.
I gotta say, in the last 4 years, the hospital's come a long way. We actually had CEO Trey Abshire here on the show about a month and a half ago. Fantastic interview. He talked a lot about what the hospital's been doing, and it's always been known as a heart hospital. I first knew about it driving down with my parents to Dolphins games on the Turnpike. I saw the Heart Institute of Florida. I was like, what is that hospital? But let's take a quick break, and on the other side, we're going to talk with Dr. Perloff about his areas of interest in cardiac care for February's American Heart Month on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today, All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. David Perloff, cardiologist, Tenet, Florida Cardiovascular Care, right around the corner of Fort Lauderdale. If you want to catch any information for Dr. Perloff, just put in his URL. It's drdavidperloff.com, DRDAVID, Perloff, PERLOFF.com. And I'll give out his number, 954-523-3422. I'll try to do it again before the 30-minute break. Now, Dr. Perloff, this is what I really wanted to get into. February is American Heart Month. Why is atrial fibrillation such a key word nowadays in the health news? I was telling you during the break, I don't think I heard even that word before 5 years ago. I know I'm probably not like everyone else, but what is it and why is it in the news?
So that's a great question. AFib is our most common sustained arrhythmia that we deal with, and it's a significant challenge to deal with it. The reason that the incidence of atrial fibrillation is on the rise is because it tends to occur in older folks. Now, I have tons of young people that have it, but the incidence of AFib increases almost on an exponential fashion as you get older. So the older you are, the more likely you are to have it. Just a good example, if you take people over the age of 80, 10% of them are going to have atrial fibrillation. It's a huge number. And so what's happening is as we see our baby boomers aging, we're seeing more and more people with atrial fibrillation. Now, there's a couple problems with atrial fibrillation. There's basically two major problems. The first problem, well, three major problems. The first problem is that some people who get it don't feel good with it, okay? They get atrial fib and they feel their pulse racing and they feel fatigued. They feel flip-flopping in their chest or palpitations. And so in those cases, we usually try to get people out of AFib, right? And that is accomplished either with medications. Sometimes we'll shock you back into a normal rhythm. And then other times we can do a procedure called an ablation, which helps to keep you out of AFib. The second problem with AFib is that people can go too fast. So if your heart rate goes too fast, that can be dangerous because it can lead to heart failure. It can actually reduce the pumping function of your heart and get you into some trouble. And so we use different medications to either keep you out of AFib or to slow you down so that you don't have, the name of it is called a tachycardia-induced cardiomyopathy. The idea is you don't want that heart to weaken based on the rapid heart rate. And then the final problem, and probably another reason you're hearing about this medical problem quite frequently, is that it is associated with stroke. So people who have atrial fibrillation have about 5 times the risk of stroke as the general population, and that's because when the atrium is fibrillating or not pumping normally, you can get little blood clots form in the atrium because the blood is not being pumped out normally. And these blood clots can then break off and go up to the brain and cause stroke. And so one of the reasons you're hearing about atrial fibrillation quite a bit is there's a lot of new anticoagulants that we're using that are advertised on TV that have really revolutionized the care of atrial fibrillation and made it much more easy and palatable to deal with. And then finally, there's also a new procedure out that is called the Watchman device, where we actually put through a catheter that we insert through the leg and up into the heart, where you put a little umbrella-like device over the area of the left atrium where these little clots form, and it seals that off so you don't get a stroke. So there's a lot of really interesting technology and information coming out about AFib, and so it's increasing in incidence and it's increasing in its information that we've got available. So that's probably why you're hearing about it.
Is that something that, say hypothetically, your patient, you pull out your stethoscope and you're listening to my heart. Do you hear AFib as a cardiologist then? Or is it something that is seen during maybe a test of some sort?
So the answer to both of those is yes.
So you've heard it before?
Oh, yes. You can hear AFib. AFib, normally the heart is very regular. Mm-hmm. Boom, 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 boom. Atrial fibrillation is called an irregularly irregular rhythm. So it sounds something like this. Boom, 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 boom. So it's completely irregular. And in fact, today I saw a patient who was sent to me by one of my primary physicians. She listened to his heart rate, and his heart rhythm was irregular. So she got an EKG, and that's how you make the diagnosis. And he was in AFib. And so she sent him to me today, and we actually spent a lot of time talking about, anticoagulation, heart rate control, different things like that. He didn't feel it at all. Some of my patients do feel it. So sometimes when people come in with palpitations, a sensation that they feel their heart racing, we'll get something called a Holter monitor, which is a 24-hour monitor. We put it on them, and then they go out and wear it in their normal activities and bring it back 24 hours later. And on that, you can see little bursts of AFib sometimes, or sometimes, hours of AFib. So you can see it on different tests, but you can also hear it.
Well, thanks for explaining AFib. That was very helpful. It's something that I think we should all be on the lookout for, because obviously can cause a lot of problems. So definitely, if you have any of those symptoms, definitely get it checked out by your primary care or your cardiologist if you have one. Now, another one of your areas of interest is lipid management. I don't know much about that either, so I got to ask you, is that something to do with blood, lipid?
Yeah, so lipids are basically the fats in our blood. So I was a biochemist before I became a cardiologist, before I became a physician. So I'm really very interested in and very big into metabolism. And so lipids are the two major lipids that we deal with are cholesterol and triglycerides, and I'm sure you've probably heard of both of those. And then cholesterol is further divided into the different kinds of cholesterol. You have LDL, which is low-density lipoprotein. You have HDL, which is high-density lipoprotein. And then others such as VLDL and IDL and things like that. So lipid management's extremely important because because cholesterol actually incorporates into the vessel wall in certain situations and ends up leading to coronary artery disease, which is the cause of heart attacks and angina and things like that. So lipid management is actually extremely important in the day-to-day day of the cardiologist.
Nice. Yeah, I was wondering. I knew it had something to do with blood, so it's actually the fat in the blood. And then cholesterol is something that sticks to the side of the artery walls. Is that when we hear that plaque and whatnot? Is that cholesterol sticking to the side?
Yeah.
Causing those problems you just mentioned?
Exactly. It turns out cholesterol in and of itself is pretty benign if it goes through what's called the LDL receptor pathway. So your liver makes far and away way more cholesterol than you can eat. It's basically your liver is a cholesterol-making factory. Everybody thinks that their diet has so much to do with cholesterol, and it does have some to do with it. But for the most part, your cholesterol is really determined from a genetic standpoint based on how much cholesterol you make and how active your LDL receptor is. And so if your LDL gets sort of taken into the liver cell through this LDL receptor pathway, it's completely benign and will never cause a problem. It's only when there's too much cholesterol around and it embeds itself into the vessel wall. What happens is with areas of injury to the vessel wall, you get white blood cells that come in called macrophages, and these ingest cholesterol and then incorporate into the vessel wall and lead to plaque formation. And if this plaque formation gets significant enough to block the artery up, that leads to heart attacks and angina or chest pain, things like that, and can be a significant problem. I mean, I spend probably at least half of my day on patients with ischemic heart disease and cholesterol plaquing. So to effectively manage these patients and prevent them from having further events, one of the absolute keys to this is managing cholesterol. Fortunately, now we've got some brand new cholesterol meds out that are really, really exciting and giving us new options for patients that we really didn't have any options for before.
And you mentioned the word prevent. What is preventive cardiology? I know it's another one of your areas of interest. And how can that help us maybe stay out of your office?
So, I often tell people cardiologists are the worst businessmen ever, or should I say business people, because, normally people in the business world sit around in boardrooms trying to figure out how to make a need for their product. And as cardiologists, we sit around all day trying to figure out how to keep you out of our office. So if you do what we tell you to do, take your blood pressure medicine, take your cholesterol medicine, eat right, exercise appropriately, don't smoke, you're going to not need us, which, is counterintuitive. I guess if I was a really good businessman, I'd be selling cigarettes and McDonald's in my office, right? But we don't do that because we really are committed to heart health. And the one thing that I tell people a lot of times is that, I can treat your heart attack. I can come in the middle of the night. We can stick a stent in your artery and save your life if we need to do that. But why? It's tragic. It's so much better for you if we can prevent that from ever happening by making sure that your blood pressure is good, your sugars are controlled, you don't have diabetes, or if you do, it's controlled, that your cholesterol is where it should be, and actually preventing things, because if we can prevent them, your quality of life is going to be way better, and overall, your health care is going to be less expensive and more cost effective, and you're going to have a better time of it. So at the end of the day, I think one of the most important things that I do is really solid preventive care because it makes a big difference.
And we only have a couple more minutes. Hard to believe that we ripped through 30 minutes, but it's been a very informative program with Dr. David Perloff, cardiologist, Tenet, Florida Cardiovascular Care. 954-523-3422. You can always see this video of this show on allcountyhealthcare.com, and I'm going to put it on drdavidperloff.com later this week when I get the video as well. And so I'm going to choose two more questions. Family history is a big thing to do with an individual's heart health, where we're coming from, the genetics that we have. Definitely.
Yes, we are absolutely products of our parents. There's no doubt. All I can tell you is the apple never falls far from the tree. So if you do have a family history, that is something very important to be aware of. It doesn't mean to be nihilistic. You have some control. We all do, but certainly things like family history of high cholesterol and diabetes and hypertension and heart disease are things we need to be aware of.
And you've dedicated your whole life to science first, and then heart health and medicine second. And I got to ask you, where did you go on medical missions to? I mean, you've done so much here locally, and Broward County, and now for the state, national with the American College of Cardiology. But where have you been on the missions?
I've been to several times, probably 5 or 6 years. I've been to a medical mission to Jamaica. We go to the poorest area there in St. Mary, which is sort of in the inner area of the country. It's a pretty poor area. In fact, it's so poor there's really no hotels for us to even stay. We actually stay in another whole parish and drive in about an hour and a half every day.
Wow.
And I would go with about 140 medical professionals. We would have mainly medical students. I do this through Nova Southeastern. I'm a professor at Nova. And so we bring medical team, which is, physicians and medical students. We bring a whole pharmacy and pharmacists. We bring optometrists and glasses and things like that. We bring dentists. We have dental students and dentists that come. We do physical and occupational therapy, public health, and things like that. And really, it's an incredible experience. I think that's a whole half-hour discussion in and of itself. But it's a very it's a great thing to do because at my office, if I'm not there, they could probably find another cardiologist somewhere in Fort Lauderdale to take over for me. But when you're on a medical mission, if you're not there, nobody's there to take care of those people. And that's really a very rewarding situation.
Well, thank you for your service and everything you're doing for cardiology. And we definitely love to have you back on the program. So I really appreciate you making the trip.
Thanks so much for having me.
And check out drdavidperloff.com. You can get any info from Dr. Perloff there. And we'll be right back on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond. We're back, and like I said, in the second half of the program, we're going to talk orthopedics, but more in depth in spine surgery, which never had a spine surgeon on the program in 2 years. I look back, and I'm really excited to find out a lot about the spine tonight. So without further ado, I want to welcome Dr. William Munoz III, spine surgeon, right here in Boca Raton Orthopedic Group, and on staff at Boca Regional Hospital. I got that right as well?
Yes, sir.
Welcome to the program.
Thank you. Thank you so much for having me.
And yep.
I appreciate it.
And now, Dr. Munoz, I wanted to ask you, so you're an orthopedic surgeon medical specialty, but then you did a fellowship in spine surgery. Is that correct?
That's correct. So,
why did you choose spine surgery? Because we don't see a lot of spine surgeons, specializing in just kind of that. I'm sure you do other things as well, but talk a little bit about why you chose to go down that path. Why the spine?
I don't know. It's just something that's always fascinated me ever since medical school. I always found the anatomy very interesting, and then further along in medical school, when you start seeing the cases and the procedures that we're able to do in terms of helping people with spine issues and nerve pain and trying to get people back up and running back to the highest level of function possible. It's always been a passion.
The spine, okay. Now, what are some of the common, and I'm going to get into them in a second. I kind of went on your website. It's a great website. I'm going to give it out a whole bunch of times. It's glades.brog.com. Ton of info on there. I feel like I met you before you walked in the door right there on the website. I always like to mention great websites that are navigable because nowadays, you sometimes you get on some of those websites and just kind of funny business. But what are some of the common spine disorders that the general population that you deal with are facing today?
Yeah, so that's a great question. So there's a full spectrum of diseases, obviously, that can affect the spine. Probably the most common thing that we see is degenerative changes throughout the spine. So things like stenosis, herniations in the disc that can cause pressure on the nerves and cause pain, whether it be pain in the neck, pain into the arm, pain in the back, pain down the legs, more commonly known as sciatica. So degenerative causes are probably the most common thing that we see, but there's also other causes. Trauma, infections, tumors are all things that can, obviously also happen in the spine.
So going back to those degenerative diseases, I never realized that if there was issues with the spine that I know the neck, that makes sense, but the arms as well?
You can, yeah. I mean, the nerves that supply your arms come from your neck. So sometimes if there's tightening or degeneration or stenosis, which is the medical term for tightening, it can cause shooting pain down the arm, similar to what happens in the low back. Again, the nerves from your low back go down to supply your legs, and that causes what is commonly known as sciatica.
I didn't know that. I'm learning something new every day we have a doctor. I was like, I have the luckiest job in the world. I get all this info. Now if I can just, bring it to myself to make myself better. No, we won't get into that. We heard spinal stenosis on the Super Bowl because Al Michaels, the host of the Super Bowl, was talking about spinal stenosis, his spinal stenosis, and I've seen it in the news a lot lately. What is that spinal stenosis that they're talking about?
So spinal stenosis is basically narrowing. Stenosis is tightening or narrowing, putting pressure either around the spinal cord itself or putting pressure around the nerves as they exit. Unfortunately, back pain and the associated nerve pain with it is pretty common in the sense of it's second to the flu. It's the second most common reason to see medical attention. So
I didn't know that.
Back issues, spine issues are fairly common. Luckily, they tend to get better on their own, and we can avoid surgery most of the time, which is the goal. Obviously, always to try and stay as conservative as possible and avoid surgery if possible. But sometimes, if it's needed, it can definitely be helpful.
And I want to ask you a little bit more about that in a second. The non-operative treatment, I think, was what it said on the website. But let me ask you again a little bit more about spinal stenosis. So that narrowing of the spine, does that something to happen with age? Is that something we can be born with? Is it congenital or?
Yeah, a little bit of both. It's
really?
Not, just like we're different heights, different color hair. We're different on the outside. We're also different on the inside. So that it's not uncommon for people to be born with somewhat smaller spinal canal than someone else when, they're able to live their life and do fine. And then all of a sudden, as time goes on and degeneration happens, you add a component of arthritis and degeneration, and it becomes relatively tight. So it can be either or.
Well, that does make a lot of sense. We obviously don't have all the same size spinal canals. That's a good way of putting it. Never thought of that before. I don't know why I was thinking that maybe all of us had the same size, but That's just me going off on a tangent. Now, a couple of other spine disorders that can be caused are from, I saw here on the website, infections as well. They can cause problems with the spine?
They can, yeah. Just like an infection anywhere. Sometimes it can affect the spine, whether it be the discs or the actual vertebra that make up the spine. And then obviously, you have your spinal cord and the nerves right next to it. So sometimes with an infection, if there's some sort of fluid collection, putting pressure on the spine or the nerves, it can cause potential issues.
A whole bunch of problems, huh?
Yeah. So it depends on, the extent of it or how bad it is. And again, oftentimes we're able to treat it medically with antibiotics, but sometimes surgery is necessary to take that pressure off the nerves.
And we're here with Dr. William Munoz, spine surgeon, Boca Raton Orthopedic Group. It's right around the corner here, 660 Glades Road, Sandler Medical Plaza, Suite 460 in Boca Raton, 561-391-5515. You got to check out their website, glades.brog.com. So I'm going to spell it out, glades.brog.com. There's a ton of info there. It looks like a great team of doctors. It looks like you're the newest to the team right out of fellowship, right?
Yes, sir.
That's fantastic. And on staff at Boca Regional Hospital, great hospital. I've taken the tour, and my PR colleague brought me on a tour there when we met a few years ago with South Florida Hospital News, and I was just amazed by the Marcus Neuroscience Institute in that hospital as well. I'm originally from the Jupiter area, so I didn't know that great community hospital existed till I moved down here, and what a fantastic job they're doing, as all the hospitals in South Florida. You guys, doctors, are doing a great job taking care of our population. Now, another common spine disorder cause, tumors. Is that something that grows over time as we become adults, or is it something, are we born with a chance to get tumors? How does that work?
That's a good question.
A deep question there.
Great question. Again, probably a little bit of both. As we get older, you do have a little bit higher tendency and likelihood of developing some sort of tumor or cancer. Obviously, you can be born with it or born with a genetic predisposition for it. The most common type of tumor we see in the spine is usually tends to be a tumor that started somewhere else and spread to the spine. So what we would call a primary tumor, or a tumor originating in the spine, is less common than a tumor that starts somewhere else that spreads to the spine.
Oh, so it can start somewhere else in the body and then spread to the spine?
Yeah.
Oh, no. I didn't know that.
Yeah.
I thought it would just start in the same spot.
Yeah, it's not uncommon for it to spread. It can spread anywhere throughout the body, including, the lungs, the liver, as well as the spine.
Wow. It sounds like you have a very complex job, but it's something that you obviously know a ton about. Tell me about your fellowship, University of Virginia, right?
Yep, University of Virginia.
Nice. I was on that website today, too, seeing who the most recent fellow is and all that jazz, and some great ones before you as well. And then the team of doctors that you have, that I guess that would be your faculty.
Yes, sir.
Just amazing. Kudos to them. Great job. So tell me a little bit about that fellowship.
Yeah, it was a great experience. I was there for a year doing my fellowship or subspecialization in spine surgery. As a big academic center, just like anywhere, including down here, in South Florida, I tend to get some of the more complicated stuff, some of the what we call tertiary, or the more complicated revision, big cases. So it's good exposure to see some really tough, complicated spine cases, as well as some of the more straightforward cases, not a massive scoliosis surgery or something along those lines.
Did you deal with everything from pediatrics all the way to adult? I read on the website.
We did, yeah.
Well, are you doing that today in your practice, or is you just adults?
A little bit of both.
You do peds too?
Yeah. I'm trained in, for kids of pediatrics, most common spine issues tends to be scoliosis.
Yeah.
So did some training in scoliosis surgery for children, and we also sometimes see it in adults.
Wow. Yeah, and I've actually wrote a testimonial once about a scoliosis, and it was just amazing. It's been published. Just quick story. the father didn't know that his daughter had it, and she was playing soccer, and out of the blue, one game she started running sideways down the field when she thought she was running forward.
Yeah.
But that spine had taken I guess that S curve, and and then amazing surgery that orthopedic surgeon did, like yourself, and was able to brace or straighten their spine. I don't know the technicalities of it, but long story short is she made her high school soccer team the next year after running sideways on the field.
Nice. Well, that's great.
Yeah, so that was an amazing testimonial. I was just like, wow, that's great work by our physicians. Now, you mentioned before, and I was going to ask you first about the operative treatment with spine surgery, but I'll ask you first about some non-operative treatment options, because you made that point before that. So it's important to have non-operative options. So tell me a little bit about some of the options for spine disorders from time to time.
Yeah, absolutely. So it's something so there are a few things in spine and spine-related issues that are what we consider true emergencies, but a lot of things we can treat conservatively, and that's sort of the discussion I have with most of my patients, is that we sort of take a stepwise approach from conservative to more aggressive treatment steps. So first-line treatment that we often try for people with back issues or neck issues are things like physical therapy, anti-inflammatories, sometimes a muscle relaxant, pain control. And the next step, depending on how you do, would be some sort of epidural injection, which can sometimes help sort of calm things down and bring down some of the inflammation. And the most aggressive thing, which try to avoid if possible, but sometimes we have to, is some sort of surgery.
Well, that's the third option, though. That's great to know that there's well, I shouldn't say the third option. It's many options down the line. That's what I mean. That's what I mean there.
Try to be the last option.
Yeah, that's interesting. As a surgeon, actually has non-operative treatments. Well, I think that goes across different medical specialties as well. Obviously, that's the more complex of the treatments when you're actually doing surgery. What's the most complex spine surgery you've seen or been part of, participated in, or even seen?
Yeah, so the most complex spine surgery that I've been a part of, they tend to be an adult with degenerative scoliosis. So that's usually a pretty big spinal surgery with fusion that can be anywhere from 8 to 12 to 14 hours. So it's a long day.
Yeah, that is like the whole day. And I actually, I'm into storytelling tonight. I don't know why, but I actually, when Delray Medical Center debuted their C-arm imaging tool years ago, I was a reporter for the Sun Sentinel, which is a big newspaper in the area, and I was invited by actually a patient who was having spine surgery, and not to see his spine surgery, but that would in case happen for me being in the room, but because it was the first time they were using the O-arm, and this patient was a reader of mine, read my column religiously, said, I want you in the surgery when they debut that O-arm. Yeah. So I had to sign everything and whatnot, and I remember all you could see was my eyes. I was in scrubs with my eyes. I scrubbed in with the doctor, and he was talking to me the whole time. They even covered my notebook, my pen, like make sure no germs, brand new notebook, brand new pen. And I was amazed, and I don't think I blinked one time during that spine surgery. And we actually had a camera woman with us, and she was right out of FAU here, Florida Atlantic University journalism program, where I actually graduated as well, multimedia journalism. But it was her first assignment with me, and her assignment was to get the O-arm, obviously, or the C-arm. Yeah. And long story short, neither of us blinked the whole time during that spine surgery, and we had to be very quiet and not cough, and it was just amazing. Though I was amazed how many people are in the room during a surgery, but just the control and the camaraderie and the you guys are amazing. Guys and gals are amazing surgeons. So really like to see another one someday as well, but we'll get to that down the road. What is the least complex spine treatment that you've seen or that you do?
Yeah. So on one end of the spectrum are the big scoliosis cases, which, and on the other end of the spectrum are the smaller, something along the lines of discectomy, or what we call microdiscectomy, which is basically for a herniated disc that's putting pressure on the nerves. So much less invasive surgery. Go in there, make a small incision, take a little bit of the bone off where it's putting some of the pressure on the nerves, and take off the piece of the herniated disc that's also often putting pressure on the nerves.
Oh, so that's a little less complex, obviously.
Yeah, it's not a 14-hour case.
Yeah.
It tends to be much quicker.
Nice. And that's that sciatica nerve that we've heard our uncles, our aunts, our grandfathers, our fathers, our mothers talk about. I mean, once that thing gets jarred out of place, I don't even know if that's the right term. I mean, it's a lot of problems, right?
Yeah, it can be painful. Low back pain and sciatica type pain is very painful, and it affects all aspects of your life. It's hard to work, it's hard to drive, it's hard to sleep, it's hard to, get up and go to the bathroom. So when you have it, it can be pretty debilitating.
You just can't get comfortable, can you, with that?
Yeah.
And people that I've seen, it's not like they can stretch it out. It kind of goes down the lower back into the leg normally, or is
Often,
it?
Yeah.
Often, yeah.
Yeah, it usually does.
Do you see a lot of that nowadays?
We do. Unfortunately, it's not uncommon. We do see quite a bit of that. And fortunately, again, going back to our overall treatment strategy, is a lot of people tend to get better conservatively. I mean, the body has an amazing ability to heal itself, so it's not uncommon for sometimes there'd be a little stenosis, and it's a little bit tight around those nerves, and they get irritated, and it gets very painful. And then if you give it some time and try things like pain control, physical therapy, sometimes an injection, it can often slowly get better with time, and we're able to avoid surgery.
Nice. Is there a way to prevent that sciatica nerve? I mean, is there anything we should be doing, being active, or?
Yeah, I mean, that's the goal of all of our treatment, is trying to get people back, out living their lives, doing the things they enjoy. I think in general, the best thing for your spine or anyone's spine is trying to be as active as possible, be healthy, work out, having...
Not carry too much weight.
Yeah.
Those kind of things.
Easier said than done, but they do tend to be the best preventative things, and also the best treatment options for people with back or nerve-related issues.
And I guess even wearing the proper equipment when you are working out, probably not jogging on concrete all the time, jogging on grass, or those hard trails with the mulch.
Yeah.
It's probably better for that to absorb that pounding.
Yeah, a little bit. I mean, ideally, if you're an avid runner and you enjoy it, I think it's okay, but obviously there's certain activities that are a little more high stress on your body than others. And sometimes when you have a flare-up, someone who's a runner, trying some cross-training or something a little bit less high impact, something like swimming or cycling, can be helpful to sort of get you through that acute exacerbation back to running.
Yeah, know your body's limits, right?
Yeah.
I've been overdoing it this week, I got to tell you. I mean, I've been in the gym twice, and it's just been overdoing it. My wife's going to yell at me because I'm starting to get sore. Now, what is that term fusion? I'm thinking it's probably not that music channel way high up in the cable. It's probably something else, right?
Yeah, so a fusion is when we fuse two vertebral segments together. So a lot of times the goal of surgery is to take the pressure off of the nerves, especially when there's tight and stenotic. And depending on the amount of bone or the amount of tissue and bone that you have to release, you can take off so much that you create potential instability. So when that happens, to prevent any future instability, we have to add a component of fusion, which basically means taking a level that was at one point moving, and you're now fusing it together, so it's not moving anymore.
What do you use to fuse it together? Is it a compound?
Yeah, a combination of some sort of cage, whether it be some sort of plastic or titanium, with bone graft. Usually use several methods to try and increase our likelihood of fusion.
More complex, huh?
Yeah.
Definitely one of complex cases. Definitely. What brought you to South Florida? I think we have less than 2 minutes. What brought you to South Florida?
So I'm originally from New Jersey. My wife is from Fort Lauderdale area, so
Oh, nice.
and all of our family's down here, and we were between Jersey and Florida, and it was pretty easy.
It's a quick plane trip.
Yeah, it's not
Yeah.
bad. It's easy to get home for the.
I have relatives in Pelham, New York, outside of I believe the Bronx. So
Yeah,
I love
okay.
taking that flight.
Yeah,
We
not too
got
bad.
less than a minute. What are your hobbies and passions outside of medicine?
I enjoy traveling.
Oh, nice.
Yeah, my wife, got married about 7 months ago, and I said we can do whatever wedding as long as we can do a big honeymoon. We did about 2 months of traveling through Southeast Asia, which was
2 months.
Just great,
Wow,
yeah.
that's the way to do it.
Yeah.
Well, congratulations.
Thank you.
Well, Dr. William Munoz, you can check him out at glades.brog.com or call 561-391-5515. Dr. Munoz, I'd love to have you back on the program. I think we could talk about a lot more.
Yeah, I'd love to anytime. Thank you
Thank
for having
you.
me so much. I appreciate it.
Thank you for coming on the You and Your Doctor show, and we'll see you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.